Hello. On behalf of Planned Parenthood Corporate Engagement, I'm Nadia Hamis and thrilled to introduce the speakers for this section on sexual and reproductive healthcare access and rights, how multilateral partnerships can accelerate gender equality and inclusive workforces. Joining us is Alexis McGill-Johnson, the President and CEO of Planned Parenthood Federation of America and Planned Parenthood Action Fund. Alexis is a social justice leader, lifelong political organizer, and tireless advocate for reproductive rights and access to quality, affordable healthcare. She is the co-founder and former co-director of the Perception Institute, a consortium of researchers, advocates, and strategists who translate cutting-edge mind science research on race, gender, ethnic, and other identities into solutions that reduce bias and discrimination and promote belonging. Alexis currently serves on the boards of Color of Change, Revolutions Per Minute, and the Narrative Initiative. Joining us from Lagos is Dr. Amy Jadasimi, CEO of Ladol, the largest privately owned sustainable economic free zone in Nigeria. Amy is an Oxford-trained medical doctor who has worked to reduce maternal mortality in West Africa. And prior to Ladol, she also worked in investment banking at Goldman Sachs and received an MBA from the Stanford Graduate School of Business. Among her many accolades, Amy was appointed to UNDP's Steering Committee on the SDGs, UNICEF Advisory Group, and Princess Trust International Advisory Board. She is a World Economic Forum Young Global Leader, Forbes 20 Youngest Power Women in Africa, and Africa CEO Forum's 50 Most Influential Women in Business. And joining us from the East Coast of the US is Dr. Cheryl Smith, Chief Economist and Portfolio Manager at Trillium Asset Management. Cheryl has spent her career in finance and sustainable investing, and Trillium offers investment strategies and services that advance humankind towards a global sustainable economy, a more just society, and better world. Cheryl served on the board and as chair of US SIF, the trade organization advancing sustainable investing across all asset classes, and thereafter on the policy committee. She holds degrees from Georgetown University School of Foreign Service and master's and PhD in economics from Yale University. And Alexis, I'll turn it over to you to kick off the discussion.
Thank you so much, Nadia. I am so grateful to join you and so many esteemed business partners committed to working toward gender equity around the world. It is an honor to be here with UN Global Compact. Your members are at the leading edge of business and civil society, pushing our imagination of what's possible when we partner to accelerate change. We at Planned Parenthood admire your commitment to gender equality and are here as a partner to support your efforts to empower women and girls and expand access to sexual and reproductive health care and education. Planned Parenthood was founded more than 100 years ago on the belief that our bodies are our own. You may know us for our healthcare provision. Planned Parenthood health centers across the United States provide access to birth control, STD testing and treatment, annual wellness exams and cancer screenings, identity-affirming care, and safe and legal abortion. By providing affordable, non-judgmental care, Planned Parenthood providers give their 2.4 million patients the tools to imagine and the freedom to imagine their futures. For nearly 50 years, our international arm, Planned Parenthood Global, has worked in countries across Africa and Latin America in partnership with Indigenous and community-based organizations to reach millions of women, men, and young people with sexual and reproductive health information and services. We know that access to comprehensive sexual and reproductive health is a powerful and critical tool for self-determination and economic empowerment, no matter where you live. Take birth control, for example. Women gained 33% in wage increases as a direct result of birth control access becoming available. College enrollment became 20% higher for girls who had legal access to birth control. Yet more than 200 million people around the world currently lack access to modern contraception, information, and services. Many also face systemic barriers to care, such as operating hours, transport costs, restrictions on minors accessing care, and cultural stigma. Supporting access to sexual and reproductive health isn't just a best practice for empowerment and self-determination, it's also good business sense. Comprehensive coverage of contraception is a high-impact, low-cost investment for companies. According to a case study from RIA Business Ventures, 83% of women of reproductive age say they would want their employer's insurance to cover the full range of reproductive health care, including birth control and abortion. Championing reproductive health care has a positive impact on a range of corporate stakeholders, from employees to investors, and that the negative consequences of inaction don't just impact the bottom line. It's never been clearer that we need to double down on our commitment to health equity. The COVID pandemic has brought health outcomes, racial and gender disparities, and economic inequality into stark relief for all of us. We've seen higher rates of women dropping out of the workforce due to COVID. This is especially true for women of color. According to the ILO in the US in September, 4 times as many women dropped out of the workforce than men. And in Latin America, women's proportional job loss was 2 times higher. Yet, in the middle of a global pandemic, when people need more access to essential healthcare, more empowerment and support from their governments, we've seen anti-sexual and reproductive health politicians around the world exploit the pandemic to deny access to basic sexual and reproductive healthcare. As long as our healthcare is stigmatized and politicized, we cannot achieve gender equity. That's why we need strong partners, particularly from the business community, to make clear that sexual and reproductive healthcare is essential healthcare and a valuable opportunity for business engagement. This moment has exposed deep disparities, but it's also given us an opportunity to address them. For companies looking to deliver on diversity and inclusion, increasing access to sexual and reproductive health services from birth control to abortion is a concrete way to support employees. The triple pandemic of COVID-19, systemic racism, and economic inequality make clear we can't afford to be incremental. We've got to be bold and transformational in our work. And business leaders are already helping us overcome challenges and realize new best practices around the way we can collaborate across sectors. So I'm so excited for our speakers today. Dr. Amy Jadasimi of LADOL and Cheryl Smith of Trillium Asset Management are committed to this work, and I'm eager to hear their perspectives. So Amy, I'm going to start with you. What is the value of companies of supporting expansion to sexual and reproductive health and rights to advance gender equality outcomes?
Thank you, Alexis. So I think there is a huge body of work that has been done that demonstrates the numerical value in terms of the benefit to the bottom line for companies that have women in the C-suite, that have women founders, that support women managers. And this is important. When you say things like the profitability of a Fortune 500 company can increase by 11% if you have women in the C-suite versus not having women in the C-suite, what that does is incentivize the company to make the investment they need to into having women in the C-suite. And it's really, really important that the economic argument is imbibed by companies because they have to invest. This isn't something that you can just sit passively and assume will happen. You have to invest in recruiting women. You have to invest in supporting, in mentoring women, in bringing women back into the workplace after they've had children, and giving them options about their reproductive health. Do they want to freeze their eggs? Do they want to step out of the workplace and come back after a year? Or do they want an environment that enables their husbands to take a year off and look after the kids so they can stay at home? So some of these things are direct investments of companies, and some of these things are about companies lobbying for changes to regulations, such as those you have in Sweden, that mandate paternal leave, for example. So there are a range of things companies can and should be doing. Doing these things requires active participation and investment, but the business case for doing this, to have a diverse environment and to have more women in the workplace is so clear that to not do it would mean that you will be outcompeted by companies that are supporting women's rights and are supporting women's equality and do have more women in the workplace.
I love that. Thank you so much, Amy. I do. I agree. When you mandate things that are non-traditional, you end up normalizing them, right? So companies can play this incredible role in shifting culture around on our expectations of sexual and reproductive health care. Cheryl, would love to hear your thoughts too.
Thank you. First of all, I second everything that you said. So this is a little bit more from a macroeconomic perspective. So at the national and international levels, widespread access to sexual and reproductive health care benefits, such as maternity care, paid parental leave, contraception, and family services, leads to higher economic growth because it provides women with greater control over their own lives. Sexual and reproductive health care is a major component of women's health. Early, repeated, unplanned pregnancies exact a toll on both women and their children, not to mention the men and their families. In the United States, the economic benefit from access to reproductive health care is clear. Since 1970, when effective birth control methods became widely available in the United States, the additional productive power from women entering the paid workforce accounts for roughly 1/4 of current gross GDP. Another way of looking at this is that the participation of prime-aged women, those between ages 25 and 54 years of age, in the US workforce increased by 54%, from just under 50% of prime-aged women participating in the beginning of 1970 to 76.9% at the end of 2019. So the effect of access to reproductive health care on women's education levels is equally compelling. And there's at least two paths by which this happens. First, by reducing the interruption to education from early unplanned pregnancies, which we see in the greatly reduced high school dropout rate. In 1970, 34% of prime-age women had dropped out before completing high school, 34% in the US. By 2016, only 6% of women in this age group had done so. Secondly, by increasing the expected return on an education, a woman who can confidently expect that she will be able to work and will be able to benefit from an education is much more likely to undertake an education. The inability to control one's own reproduction greatly reduces the incentive to pursue education. In 1970, only 11% of prime-age women held a bachelor's degree or higher. By 2016, this figure had increased to 42% of women, made possible by the availability of widespread access to effective birth control. These social and economic benefits to the overall economy are clear, but why should a business owner care about providing employee access to sexual and reproductive health care? From the perspective of an individual company, expanding access to women's health care through these policies helps address systemic inequities, reduce the gender gap, and advance inclusion in the workplace. Companies that are serious about expanding opportunities for women in the workplace need to consider the obstacles to women's progress in the workforce. Providing access to sexual and reproductive health care both signals a company's recognition of gender issues and moves a company forward towards greater gender equality and helps them keep competitive. In contrast, shifting a higher burden of their healthcare costs to women than to men by restricting coverage of reproductive healthcare clearly increases the barriers to women's participation in the workforce and clearly signals to women that their participation is neither needed, nor necessary, nor wanted. As an investor concerned with gender equality, we examine companies' policies and we hold them accountable for making progress on these issues.
Thank you so much, Cheryl. Absolutely. I think accountability is key to make sure that all companies and governments are working to live their values, right? So I really appreciate that data set. Amy, back to you. Why do you see multilateral and cross-sector partnerships as key to accelerating progress?
Thank you. So in answering this, I'd like to touch on something Cheryl mentioned, which is the impact on GDP of female equality. So I think we're all familiar with the McKinsey study that shows a $25 billion increase in global GDP if you can achieve parity in the workplace for women. Now, in countries like Nigeria, which is high growth, low income, we see figures bandied around from 0.5% to 5% increase in GDP from increasing female participation in the economy. And we should always say that the formal economy, because obviously in the informal economy, women are already leading. I think that these GDP numbers grossly underestimate the impact that women can have. So if you look at multilateral institutions such as the UN, just to pick the most relevant one to this talk, if you want to achieve the SDGs, we need to create 680 million jobs. Most of those jobs will be in low income, high growth countries. Most of those jobs will be created by SMEs. And the jobs have to come from an increase in the private sector activity in these countries. And if you look out 50% of the population from participating one way or another, either through paternalistic policies that haven't been changed, or actively excluding women from access to reproductive health education, let alone formal education, we aren't going to achieve that job creation. We aren't going to achieve the SDGs. So that's why we say in order to achieve the 17 SDGs, you must achieve SDG 5. And in achieving SDG 5, you will also achieve massive, I think, GDP growth in these low-income, high-growth countries such as Nigeria. So any multilateral institution that's interested in helping countries achieve the kind of growth we need the entire African continent to achieve has to look first and foremost at women's issues, has to look at women's equality. And obviously one of the biggest barriers to women being able to participate in the economy is around reproductive health in general and education as well. Now, multilateral institutions already spend a lot of money in this area. So on the one hand, I'm saying they have to look at women's health, women's education, particularly in the reproductive area. On the other, I'm saying they have to look at what they're doing that is stopping that from happening. A lot of the policies that multilateral institutions and international organizations pursue in countries like Nigeria may inadvertently be excluding women from the workplace. And that's why I love what Cheryl said about her fund, Trillium, insisting that the companies they focus on address these issues head on. Because if you think about it, if you're a multilateral institution and you're supporting companies that aren't addressing these issues and don't have policies that are aligned with the SDGs, that are aligned with female empowerment and access and parity, you are promoting the status quo. And in countries like Nigeria, that does huge damage. It really sets us back, not just by months or years, it can set us back by decades if you empower institutions to continue excluding women. So all of these things are interconnected. Multilateral institutions have a great role to play because they're already playing a role in our countries. And we want to make sure that that role achieves the correct outcome. And since we no longer have to debate what that correct outcome is, we can focus on making sure that we exclude all efforts currently being made by these institutions that don't empower women, that don't enable women to access education, to access the workplace, and don't move us towards parity. Thank you.
Thank you so much, Amy. Cheryl, how about you? What's the macro lens on how you see multilateral and cross-sector partnerships and the ways in which they accelerate progress?
Thank you so much. And Amy's discussion was very powerful of the ways in which that SDG number 5 is so central in reaching all of the other goals. So I'm going to talk a little bit about a theory of change, if you will, and really the question of why partnership. So I'm going to use a common but very, very profound phrase, which is that many hands make light work. We know that the progress for women and girls results in progress for societies as a whole, the connection between SDG 5 and everything else. And yet, this is a really daunting undertaking as the position of women involves so many interacting and often reinforcing systems, including social, economic, cultural, and religious systems that are used to justify the position of women. As an investor working to improve environmental and social outcomes, we advocate with companies to improve their practices on promoting diversity and gender equality. And in our work, we have found that change in corporate and legal and governmental organization and behavior often results from multiple points of interaction and engagement. In order to generate these multiple nudges towards change, all stakeholders need to do their part to accelerate progress by creating interaction and engagement. So Amy has talked about the effect of, sort of inadvertent policies leading to something, but I want to talk to every single person having to do the part. So working in partnership allows each organization, each investor, each individual to address some aspect of the overall complex of behaviors and systems. And as an example of how this works, I'm just going to cite one thing from the United States, which is the 30% Coalition, which is a coalition that works on board diversity. This coalition brings together corporations, investors, and advocacy groups, all with the goal of achieving diversity in senior leadership and the corporate boardroom with the further goal of improving outcomes for women and diverse members of the workforce entirely. So advocacy groups here highlight the importance of the issue, and they provide academic and statistical support for the benefits of greater leadership diversity. Investors bring the pressure of the market to bear, making it clear to businesses and corporations that investors, who are their owners, care about the issue and will act on it. Corporate leaders work together to share best practices, highlighting both what works and, importantly, what has not worked. And over time, the coalition works to increase the percentage of women in leadership. As the representation of women in leadership slowly increases, outcomes for women across the workforce improve. At the same time, the logic and compelling case for appropriate healthcare access and coverage for women employees becomes stronger and stronger. So this is not just a case of trickle down, change it at the top and it changes everywhere. It's a change at the top is a lever to improve the outcomes for women employees across the firm. And as the 30% coalition example shows, bringing together multiple groups in a coordinated partnership produces many small instances of change. I believe if we truly want to improve the status of women and to provide opportunities for girls to flourish, we must work together, each in our own way. Women supporting women, as we are on this panel and as women do across the world. Businesses recognizing a common interest in greater opportunities for women. Governments and NGOs supporting access to reproductive and sexual health care that offers the opportunity for women to control such a central part of our lives. Many small instances of change, many nudges in the direction of opportunity and agency, when brought together, create a tidal movement over time, one that has a power for true transformation. And by working in partnership, each organization, government, corporation, and individual can contribute to lasting change. Many hands can indeed make light work, even enough work to change what seems immutable and unchangeable. Thank you so much.
Thank you so much for that, Cheryl. Thank you so much, Amy, for your insights and your leadership. I love that theory of change, not only lightening the load, I'm sure we also see innovation and other things come out of that theory as well. So we've heard the power of business leaders taking action to address sexual and reproductive health care access and affordability and the transformational outcomes that can have for companies and for communities. Businesses can help reinforce that sexual and reproductive health providers and care are a critical part of the public health infrastructure. Companies can start by looking first at their own internal practices, walking the talk around their values and commitments to gender equality by ensuring coverage of sexual and reproductive health care, including birth control. Companies can also use their power to advocate for policies that expand sexual and reproductive health access and affordability. Women consider the policy environment in their career decisions. According to the case study I mentioned from RIA Business Ventures, 56% of women would not apply to a job in a state that recently banned abortion. We know that talent is the #1 internal concern for global CEOs and companies that are already investing to strengthen the talent pipeline. There's a real opportunity for businesses to create a multiplier effect across their communities and into future generations by empowering women and girls with sexual and reproductive health care and education. Planned Parenthood's here to be a strong partner with you in all of your efforts. If you're interested in getting more involved with us, there are many opportunities, including becoming a business for birth control. Please reach out to our corporate engagement team or to UN Global Compact for more information. I want to thank Amy and Cheryl again for sharing their perspectives. We look forward to our ongoing collaboration with you, and we welcome new businesses interested in partnership with Planned Parenthood. And thank you so much to the UN Global Compact for making space for this important conversation in today's agenda. Planned Parenthood looks forward to being a resource for you and your members to accelerate gender equality. Thank you.